PARP inhibitors are certainly one of the most exciting development in the treatment of ovarian cancer patients. We have, over the last 7-8 years, conducted several studies with a variety of PARP inhibitors that have all shown that they do mean a valuable difference for patients. We have tested various PARP inhibitors in the treatment setting, in the maintenance setting, and are now combining PARP inhibitors in clinical trials with other drugs. There are 3 PARP inhibitors currently approved for ovarian cancer patients, namely niraparib, olaparib, and rucaparib. Rucaparib and olaparib can be used in patients that have either germline and in the case of rucaparib, somatic mutation in BRCA1 and BRCA2 for treatment. Olaparib and niraparib also have indications for maintenance therapy in those patients that have successful treatment of platinum-sensitive ovarian cancer recurrences. We have seen in a variety of studies that maintenance therapy with PARP inhibition in this group of patients with platinum-sensitive recurrent disease provides a very meaningful increase in progression-free survival. And certain patients have very long-term survivals that last more than 5 or 6 years, for example, in olaparib. And those are observations that to all of us in the field that treat ovarian cancer patients are extremely exciting. And we likely are going to see outcomes here that we have never seen before.
PARP enzymes are important for the repair of single-stranded breaks in DNA. So PARP inhibitors don't allow PARP to repair these single-stranded breaks, which then, during the replication process, become double-stranded breaks. Cells that have mutated BRCA1 or BRCA2 or HR deficient are then unable to repair these double-stranded breaks. And again, with replication and going to a more error-prone mechanism of repair, these double-stranded breaks ultimately lead to cell death. Another mechanism by which PARP inhibitors can cause cell death is by PARP trapping. So a PARP inhibitor can bind PARP on damaged DNA and prevent replication of the DNA, and it actually acts as a poison, also known as PARP poison.
So there are 3 PARP inhibitors currently FDA approved, and they have a slight, 2 of them have a similar indication on the label now, and one being unique is rucaparib. Rucaparib is still just indicated for treatment of disease for patients that have had 2 prior lines of chemotherapy. These are patients that have both a germline or a somatic mutation, so the tumor itself carries a BRCA1 or 2 gene mutation. Now, additional data is obviously coming out that may expand their label, but at the current time, that information is in front of the FDA. As far as when we look at olaparib and niraparib, they do have as well as a treatment indication that olaparib has for the 4th-line therapy. Olaparib and niraparib have a maintenance indication after 2 prior platinum-based chemotherapies. If they've had a partial or a complete response to their platinum therapy, they can be considered for maintenance therapy. And those were borne out in trials that looked at the active PARP inhibitor versus placebo. And that maintenance indication is for all comers at this point. So regardless of BRCA status, HRD status, patients can receive maintenance drug if they have that quote-unquote biomarker of responding to platinum twice.